Now, Dr. Christine Chiaverini unfortunately couldn't make it. She's based in Nice in France. She's an EB dermatologist and a researcher, and her particular focus is on EB simplex. Even though she couldn't make it, she sent us a video recording of her presentation, and I'm going to start that now. So her work is looking at Apremilast.
Our project on Apremilast on EB simplex patients, funded by UK. This project is promoted by the EB Center of Nice in France, of which I am the leader, just here. We are a small but old EB center whose history began in the 19th in the research laboratory of Professor Horton with the discovery of genes responsible for some junctional EB. In 2008, the Clinical Center for the Management of EB Patients was created. Since then, we conduct several clinical and fundamental research projects. We work with the other EB reference and competence centers in France and with DEBRA France. Why this study? In 2019, we published a study showing that patients with generalized EBS have a peculiar skin inflammation and that Apremilast, a psoriasis treatment, could improve skin blistering. Since this publication, we off-label treated 6 adult EBS patients with keratin 5 or 4 mutation with Apremilast. All patients improved, but 2 stopped their treatment for adverse effects. Then, we want to demonstrate the effectiveness of Apremilast in EBS patients, in adults and also children who are usually more affected. What Apremilast is? Apremilast is a small molecule for treatment of psoriasis. It will be available in France for children in September 2024. Since its commercialization in 2016, Apremilast has been evaluated in a lot of genetic and acquired inflammatory skin diseases with some success. For example, it's now used for most ulcers related to Behçet disease. Apremilast has good and bad qualities. Good qualities are oral home treatment, not injection, no blood analysis mandatory, no severe adverse effects, and its effectiveness in the few patients we treat. Bad qualities are it had to be taken twice daily, frequent digestive discomfort, including nausea, vomiting, or diarrhea, usually improving with the treatment, possible headache, and very rare mood disorders. What is concerned by this study? All patients under 6 years old and 15 kilograms of both sexes with EBS and at least 3 new blisters a day, depending on their localization and their size. The number of new blisters a day is the average number of new blisters a day the week before the visit. Which kind of study? It is a very original study designed for rare disease with few patients. There is no placebo treatment. All patients will take Apremilast. Protocol is organized in 3 successive periods: a 2-month treatment period, period 2, a 1 month without treatment period, period 3, and 1 and 3 months treatment period, period 4. The aim is to show that the number of daily blisters decreases with the treatment intake and increases when it's stopped. When does it start? We hope to start in June for adults and September for children. The inclusion period will last from 9 to 12 months, depending on the date of the first inclusions. We plan to include 20 patients in 3 or 4 centers in France. It was not possible to open center in UK due to a lack of nurses in English centers. What are the actual issues for this project? Regulatory authorities are very long, complex and fussy, so it takes very lot of times. The pediatric form of Apremilast exists and has been validated for the treatment of psoriasis in children, but it has not yet obtained the marketing authorization in France. It should be available only in September if, of course, everything goes okay. We will start with the adults first and then, when possible, children. Thank you so much for your attention and have a nice Debra weekend.
So, in summary, they're hoping to try Apremilast in adults in June this year and hopefully children in September this year. It means if all goes well, we'll have the results of this trial by the end of 2025. And if it works as well as we would like to, in 2026, we can go to the NHS and try to get this prescribed off-label in the UK. So we can update you towards the end of next year.